NCLEX SATA Maternity Questions Updated 2026. Question 1. Select all that apply that is appropriate when there is a benzodiazepine overdose. Option A. Administration of syrup of ipecac. Option B. Gastric lavage. Option C. Activated charcoal and a saline cathartic. Option D. Hemodialysis. Option E. Administration of flumazenol. The correct answers are options B and C and E. Gastric lavage, activated charcoal and a saline cathartic, administration of flumazenol. Gastric lavage and charcoal are used for decontamination. Flumazenol is the specific reversal agent. Ipecac is avoided due to aspiration risk from sedation. Question 2. A neutropenic child is receiving chemotherapy. Which interventions would the nurse initiate to implement protective isolation? Select all that apply. Option A. Restrict all visitors. Option B. Place the child on a low-bacteria diet. Option C. Change dressings using sterile technique. Option D. Encourage the consumption of fresh fruits and vegetables. Option E. Perform meticulous hand washing before caring for the child. Option F. Allow fresh-cut flowers in the room. The correct answers are options B and C and E. Place the child on a low-bacteria diet. Change dressings using sterile technique. Perform meticulous hand washing before caring for the child. Low-bacteria diets, sterile technique, and hand washing protect the immunocompromised child. Fresh produce and flowers are avoided as they harbor pathogens. Question 3. The nurse is preparing a teaching plan for a client who is undergoing cataract extraction with intraocular implant. Which home care measures will the nurse include in the plan? Option A. Avoid activities that require bending over. Option B. Contact the surgeon if eye scratchiness occurs. Option C. Place an eye shield on the surgical eye at bedtime. Option D. Expect episodes of sudden severe pain in the eye. Option E. Contact the surgeon if a decrease in visual acuity occurs. Option F. Take acetaminophen for minor eye discomfort. The correct answers are options A and C and E and F. Avoid activities that require bending over. Place an eye shield on the surgical eye at bedtime. Contact the surgeon if a decrease in visual acuity occurs. Take acetaminophen for minor eye discomfort. After eye surgery, mild scratchiness is normal, but severe pain can indicate complications like hemorrhage or increased intraocular pressure. Clients should avoid bending over and use an eye shield at night. Question 4. A nurse suspects pulmonary edema in a client with heart failure who develops dyspnea and tachycardia. Which interventions does the nurse expect to be prescribed? Option A. Administering oxygen. Option B. Inserting a Foley catheter. Option C. Administering furosemide. Option D. Administering morphine sulfate intravenously. Option E. Transporting the client to the coronary care unit. Option F. Placing the client in a low Fowler's side-lying position. The correct answers are options A and B and C and D. Administering oxygen. Inserting a Foley catheter. Administering furosemide. Administering morphine sulfate intravenously. Oxygen, diuretics like furosemide, and morphine are standard for pulmonary edema. A Foley catheter tracks output. High Fowler's position is preferred over low Fowler's.